and welcome to Code Rhetoric with Tam Talk. On today's video, we will be doing some surgical code with me, and we will be focusing on the gastroenterology procedure. Before we get started, I want to put out our disclaimer, which again is the surgical case that we will be discussing or reviewing is a fictitious operative report, and it is to be used for teaching purposes only. The coding tools used are recommendations only, and this is not a sponsored video. Some links are affiliate links, and I may receive a small commission. The recommendations are based on personal usage and or experience. So our coding essentials for this procedural video does include your 2022 or 23 CPT manual, your 2023 ICD-10-CM coding manual, and if you have access to an encoder such as 3M Codified Optimum, that will be useful as well. So the title of our procedure is the laparoscopic gingivostomy. So first things first, whenever you are coding a surgical or procedural report, you must define why the surgeon is actually performing the surgery or procedure. And we do that by defining what our diagnosis is, or our ICD-10-CM code. And so our preoperative diagnosis is the SMA syndrome, and our postoperative diagnosis is the SMA syndrome. So as you can see, our pre-op and post-op diagnosis is the same. So what are our indications for the procedure? Again, this ties in with our diagnosis as well. So the patient has persistent SMA syndrome and does not tolerate nasal jejunal feedings. So this is why the surgeon decided to present to the OR to rectify this particular issue. Now we move into the body of the surgical note, and it's important that you pick up on the specific terms or key terms that will help guide you to the correct selection of your CPT code. So in our title or in our description of the procedure being performed, the surgeon stated that he was going to perform a laparoscopic gingivostomy. Excuse my pronunciation here. So the first thing we're going to look for the position of the patient, which is the supine position. We're also going to identify the type of anesthesia or anesthetics that was used. As we can see here, the doctor administered general anesthesia. So of course the abdomen was prepped with ChloraPrep, and as we proceed further down in the note, we notice that the doctor infiltrated the trocar sites with the Marcaine and epinephrine. So this is a key term that is important when it comes to laparoscopic procedures. You will notice that whenever a laparoscopic procedure is performed, the surgeon will notate that trocar sites and trocar tools were utilized in order for them to access the body or the orifice. So a 5mm trocar was placed. A right-sided 12mm trocar was placed through a previous trocar incision, so that lets us know that the patient had a laparoscopic procedure done previously. And then if we move to the left side, the surgeon did also again use a 5mm trocar. And so upon initial exploration into the intra-abdominal anatomy, it did appear normal. So the ligament of Tress was identified, and an appropriate loop of jejunum was brought up to the stomach. The most dependent portion of the stomach appeared to be just on the anterior aspect of the junction of the body and atrium. And this is where your medical anatomy is very important. So then the anti-mesenteric, border of the jejunum was then sutured to the stomach to line up a gastrogingivostomy. That's a lot of ostomies, right? And jejus. This was done with the 2 to 3 vicral sutures. The jejunum was lined up in an isoperistaltic manner. An enterotomy was made on the distal stomach and jejunum. So the enterotomy is an incision into that particular site. So remember, your otomy is the incision, right? Your incision. Ostomy is a creation of an opening. Again, otomy is incision, ostomy is the creation of, right? Okay, so then if we move on, progress further down into the note, again, the jejunum was lined up in an isoperistaltic manner, An enterotomy was made on the distal stomach and jejunum. An endogia Tam lobe tri-staple was then inserted into the lumen of both the stomach and the jejunum. Care was taken to ensure that nothing else was incorporated into the jaws of the stapler, and the stapler was fired. So the endogia Tam, again, is self-explanatory. It is a stapler that is used for endoscopy procedures, as we see here. Next, the anastomosis was inspected and noted to be hemostatic. The remaining enterotomy was closed with a running 3-0 vicryl suture. The stomach was then insufflated with a large amount of air by anesthesia. The anastomosis was noted to be airtight. So the anastomosis, again, is where the surgeon went in and he made an incision into a part of the intestine. Then he stapled the end of the intestine into the stomach, right? So that created an anastomosis. So then the stomach was then deflated through the orogastric tube. The tube was then removed. A tongue of omentum was then tacked over the sutured portion of the anastomosis. Good hemostasis was noted. The abdomen was desufflated and the trocars removed. So when we see where the trocars are removed, this is mean that we're coming to the end of our procedure. The umbilical trocar site was closed with an interrupted 2-0 PDS suture. The skin at all trocar sites was closed with dermabond. And general anesthesia was reversed, and the patient was taken to the PACU in stable condition. The doctor stated that he was present for the entire procedure. So that lets me know that maybe a surgeon, or a resident was also involved in this particular procedure. So the disposition of the patient was stable as they returned to the PACU setting. So here we have our providers listed, and again, the anesthesia type that was utilized. So our surgeon's name is Johnny C. Lately. Assistant, the doctor documented there weren't any assistants, and the anesthesia type is general anesthesia. And this report was dictated by Dr. Johnny C. Lately. Now, we have a little discrepancy here because the doctor did mention that he was present for the entire procedure, and that's typically a statement that is utilized or documented by a teaching physician. However, we don't have a resident listed here, so we would pause here and then we would query the provider based upon the documentation in the note. Again, the doctor mentioned that he was there for the entire procedure, which is an indication that it was performed perhaps by a resident and the surgeon was acting in a teaching physician capacity. In that case, we would need to pause because, again, as we can see here, the name of the resident is not listed, and we would go back to the physician to query for further information as it relates to the resident or the additional providers that were included on this procedure. Now that we have the details of the procedure, let's begin our coding. To locate our ICD-10-CM or ICD-10 diagnosis, we must learn how to drill down in our ICD-10 coding manual, and we do so by identifying our main term. So in this case, our patient presented with the SMA syndrome, and our main term is syndrome. Once we locate syndrome in our ICD-10 coding manual, we're then going to drill down or scroll down to the type of syndrome the patient presented with. And in this case, the patient presented with SMA syndrome. And so SMA represents the abbreviation of the superior mesenteric artery. So, of course, when you drill down in your ICD-10 coding manual, you're not going to see SMA. However, you're going to identify superior mesenteric artery, which again represents the SMA syndrome. So again, identify your main term, which again is syndrome, and then what type of syndrome. Then we're going to drill down to the superior mesenteric artery. And so that again will help us locate our ICD-10-CM code selection. So when you're selecting your CPT code, of course you can use your encoder, but if you're using this CPT coding manual, you want to start with the system, and this is where the medical terminology and anatomy and physiology comes into play, because this is going to help you drill down or get closer to your code selection or the neighborhood for your code selection. So we know that the jejunum is part of the digestive system because it is intestine, right? The small intestine. So then we know we're going to go to the digestive system. So once we locate the digestive system, the particular systems within the CPT coding manual are broken down even further based upon the anatomical location within that particular system. So once we get in, again, once we get to the digestive system, we're then going to proceed to the intestines, or the intestine section of our digestive system in the CPT coding manual. But if we go back and we look at the description of the procedure that was performed, this procedure was performed laparoscopically. So there are also laparoscopic procedures within the systems of their CPT manual. So we know we need to be looking for a laparoscopic incision or an opening, or a creation of an opening in the intestines, which are located within the digestive system. So once we drill down to all of these particular categories, again, based on what was described in the operative note, that will help us either get close to our code or get us directly to our CPT code for the procedure. So in this case, our code is 44186. Again, it is a representation of a laparoscopic surgical gingivostomy. And if you recall the note, or within the note, the doctor or the surgeon did mention that it was for feeding issues or feeding concerns, as well as decompression. So as you can see here in the description of the code, it also provides examples of when this particular procedure would be best used. And again, it's for decompression or a feeding. So again, we're going to locate or identify our particular system. Once we get to this correct system, we're going to look for the anatomical location, and in this case it is the intestines. And then we're going to look for the type of procedure was performed, whether it was an incision, excision, or was it performed laparoscopically. In this case, it was performed laparoscopically, so our CPT code is 44186. So first, we're going to assign our diagnosis or our ICD-10-CM code or codes. So since both the pre-op and post-op diagnosis is the same, we're going to assign that code for that particular diagnosis, which is K55.1, which is for chronic vascular disorders of intestines. Our CPT code or codes is 44186, which represents the laparoscopy, surgical gingivostomy. An example of that is for decompression or feeding. So this concludes our video tutorial on gastroenterology surgical procedure coding. To learn more, please visit our website at www.abrahammedicalcodingcoachllc.com. If you have any business questions or business inquiries, please feel free to email me at abrahammedicalcodingcoach@gmail.com. And also be sure to follow us or subscribe on Instagram, Facebook, and LinkedIn. Thank you.